all the research that was done on heart disease used men. And so the classic signs of heart disease or a heart attack in a man is different than what it is in women. And so women may not feel crushing chest pain. They may feel nausea. They may feel back pain. So it's not the classic symptoms. If you know something doesn't feel right, then you have to keep escalating that concern and take it up what I call the chain of command. So if you feel something's not right, it probably isn't right.
What's up, ladies? Welcome to the health class she deserves, the show where we ditch outdated women's health myths and talk real bodies, real cycles, and real stories. I'm your host, Autumn Paone, and today we are welcoming Dr. Julie Siemers to class. Dr. Siemers is a patient safety consultant, industry nurse leader, educator, and TEDx speaker. She is also the founder of LifeBeat Solutions and the author of the best-selling book, Surviving Your Hospital Stay, A Nurse Educator's Guide to Staying Safe and Living to Tell About It. Dr. Siemers holds a Doctor of Nursing practice degree from Touro University in Nevada. She brings more than 4 decades of experience and expertise in nursing practice education and executive leadership to the healthcare arena, with a rich background in direct patient care and experience in various roles on the medical and surgical care floor, in the intensive care unit, the emergency department, and the trauma resuscitation department. She has also served as a flight nurse on a trauma helicopter for 10 years. Since 2009, Dr. Siemers has been educating students, colleagues, and the broader medical community on the vital skills needed to recognize patient deterioration and ensure safe nursing practices. Now, as a patient safety expert and the founder of LifeBeat Solutions, she is on a mission to make healthcare safer for everyone. Dr. Julie, welcome to class.
Thank you. Appreciate being here.
I appreciate having you here, and I'm very excited for this conversation today because it is such an important one. And it's something that's kind of been like I've mentioned on the podcast before, but I've never sat down with an expert. So I'm very excited. Let's start at the beginning. As I said, you have decades of experience working in the medical field, but what was the catalyst to becoming a patient safety expert and starting LifeBeat Solutions?
Yeah, I was a bedside nurse for 30 years, as you talked about. And then when I entered nursing education, I needed to finish my master's degree so I could teach in the classroom. And the topic I chose for my thesis was patient safety. And that was the beginning of me peeling back the layers and really understanding the crisis in healthcare about patient safety that really nobody talks about. And for good reason. It scares people to know how many mistakes are being made out there. But I wanted to bring this awareness again as I started researching back in 2009 and then finished my doctoral degree on this topic as well. Because I think the more informed and educated the general public is, the more that we can impact patient safety outcomes and keep our loved ones safe. And so I think it's a really important topic, which is why, I wrote my book to help patients and their families and just raise the level of awareness, because the first step in finding solutions is knowing that we have a problem, right?
Mm-hmm. Yeah, absolutely. Because I understand what you're saying with like, yeah, it's like scary. And so it's obviously not something that somebody's going to want to like talk about and make really obvious. Like, hey, healthcare workers are also human, but it's really important. And like you said, the more prepared, the more knowledge we have, the more prepared we can be. So you describe yourself as a bridge between what patients experience and what healthcare systems actually do. Can you unpack that a little bit?
Yeah, it's what the theme of my TEDx talk was about also, because up till now and still very pervasive is patients and families taking a passive role in their own healthcare, thinking the doctor knows best, and thinking, well, I haven't been to nursing school and I haven't been to medical school, so we just accept everything that comes to us. And the nursing teams are even more overloaded than they have been in years past, and so it's even more essential that we can be the eyes and the ears for the healthcare team. And that means ex- communicating with the team about your loved one because you really are the expert in your family member, right? If your mom is 80 years old and usually alert and oriented and knows what's going on versus someone who's got a baseline of dementia or confusion, that's a big difference. And the healthcare team aren't going to know if you don't tell them, hey, this isn't my mom. My mom is never confused. Whereas the nursing team or medical team sometimes can assume because someone's 80 years old that they've got a baseline of dementia or confusion. So it really is being the conduit and building that bridge between, hey, I've noticed my mom's heart rate has been elevated watching the monitor in her room for the last few hours. And now she's beginning to look a little different to me. Can you come and make sure everything's okay and do an assessment? It really is just being that part of the healthcare team you didn't know you could be.
Yeah, and that's empowering. It gives some agency like back to yourself in that sense of, yeah, you need to communicate these things because like you said, like you're the expert on your situation or your family member's situation, and the doctors are and nurses are dealing with so many different patients, and being able to have that background of like, yeah, this isn't what my mom ever is like. That's like really key information. I would love to talk about because you say that most harm isn't caused by bad people, but by broken systems. And I think that is something really important to talk about, especially as like recently I've been doing a series on TikTok where I'm reading stories from women about things that they've been told in the doctor's office that just like aren't okay. And it's been really blowing up. Like people are really resonating with with this series, and I find it like a really important point to make of like, okay, most medical professionals are like amazing people that have dedicated their life to such a amazing cause to like help people, and they are also constrained by the same systems that we're all constrained by. So, can you talk about how these broken systems are disproportionately affecting women?
Yeah. Most of the healthcare team, the nurses, most of them are women. I mean, probably 85% ish are women. But again, it's like multitasking, as you mentioned, doing so many tasks that they aren't able to really pay attention to our family members and notice the things that we would do. So I think, there's this Swiss cheese model of failure of systems to um, line up and work correctly. And I'll give you an example. Several years ago, it came across the news because it was a pretty big deal about a nurse that gave the wrong medication to a patient at Vanderbilt Hospital, and the patient ended up dying. Vanderbilt settled with the family, swept it under the rug to try to keep it hush hush, and fired the nurse. Well, when an anonymous tip came through, and they did the investigation of what we call root cause analysis, which all patient harm should have this process. But again, hospitals don't always have the capacity, the manpower to do it. And it's not federally mandated. They just have to say, yes, we're doing it. And I think there was a study out a few years ago that said there's only probably 1 out of 10 um, wrong events that happen at a hospital that actually get a full investigation. So, again, if we don't know what the problem is, then we're not going to find solutions to it. So, in this case, a couple of things that they found at this investigation at Vanderbilt was the medication that the nurse thought she was given was an anti anxiety medication called Versed. So, Versed has the capability to lower blood pressure, to slow down breathing, to affect a patient. They didn't have a policy that every patient that gets Versed should be monitored. If they did, that's one stopgap that the system could have prevented this mistake from happening. So the medication the patient actually got was a paralyzing agent, which means she couldn't breathe. And so when they put her in the CAT scan and didn't monitor her, they didn't realize till 30 minutes later when they pulled her out of the CAT scan that she had stopped breathing and now had anoxic brain injury. And so, as a systems error, having that policy in place, even though it was the wrong medication, it still would have necessitated that they monitor that patient during the procedure. They also found that this nurse had floated to the radiology department, never worked there before. They also found that she was orienting a new nurse at the same time as trying to do her job at a place she wasn't familiar with. So that's an accumulation of systems errors that actually, there was more, but that actually led to this patient getting the wrong medication and dying.
Wow. Yeah. So, yeah, just having those like checkpoints in place, I can imagine would make a world of difference. What is your advice that does to somebody listening who is, just heard that story and is now like, oh my God, I'm scared to go to a doctor's office ever again or a hospital ever again. What's your advice then for either recognizing that as the patient, where those gaps can be, or recognizing burnout in a nurse or something? What can we do to help fill those gaps?
The best thing you can do is take an active role. And by that, I mean, say you're in the hospital visiting your dad. Let's just say he had a stroke or open heart surgery. The nurse comes in the room to give the medications. Your questions should be, what medication are you giving my dad? Oh, well, this is for his high blood pressure. Oh, well, I see that his blood pressure isn't high right now. Is that something he really needs? Just asking the questions. You can do it politely, but medication errors are probably the most common harm event that occurs to patients in the hospitals. And so in nursing school, we teach the 5 or 6 rights that every nurse should do before every medication given to every patient. The right patient, so checking their armband. Most places have a barcode scanning system, some don't though. um, the right patient, the right medication, the right dose, the right route, and the right time. And so if the nurse is in a hurry because they've got, 8 patients to pass medications on, they may skip some of those and take shortcuts, which is where harm can occur. I'll give you another example. There was a patient that came back to the hospital because she had knee surgery 2 days prior, and now her knee was swollen twice the size that it should be. And she had a lot of pain in her foot. And so, long story short, on discharge, this patient was given an anticoagulant medication, which is common after surgeries like knee surgery, hip surgery, but she also was on home medications. One of those was also a blood thinner because she had a heart condition. And so she got double anticoagulants, which means that's what was happening in her knee. She was bleeding at the surgical site, which then caused compression on her tissues, preventing blood flow to her foot. So she could have lost her leg. It's something we call compartment syndrome. And again, that was an error involving medications that somebody should have noticed. Oh, she's already on an anticoagulant. We need to call the doctor just to confirm, should she be on both? And I bet the answer would be no. And that's the kind of where you just have to ask questions and speak up. Why are you giving my mother, a pain medication? Or why aren't you, when she's complaining of pain? And again, it's not being accusatory, but it's being interested and involved in asking questions. And they should be informing you of the care that your loved one is receiving. So I'll take that into another opportunity to get involved is when you're waiting for diagnostic results. So, for example, and I wrote about this story in my book too, a man had a brain tumor. The surgeon came out and told his wife, don't worry, it looked benign. So she and her husband didn't worry about it. But what happened was the pathology report that came back a week later got misfiled, and so it did say that it was cancerous, but nobody told the doctor, nobody told the family. And then when the patient 6 months later has another headache, raging headache, and finds out the brain tumor, he has another brain tumor. And then they find the original pathology report. So diagnostic errors are another opportunity that we can intervene as family members. You can say, hey, I noticed my dad's potassium level was low yesterday. Is it better today? Just getting a notebook, taking it with you, and making notes. Hey, how was my dad's lab work? Well, his white count was elevated. And then the next day, but we're giving antibiotics. The next day, is my dad's white count improved? And it's just asking questions. Again, you don't need a nursing degree for this. And
Mhm.
you can look it up on Google or even AI and say, what does an elevated white count mean? And then
Mhm.
you're just going to know it means there's potential infection. And so you're going to watch the trends.
Mhm. Yeah, the honestly, just the modern day, like, the access to the internet that we have is definitely really useful because I always do that with when I'm just getting either routine blood work or if I'm getting blood work for a specific problem. I'm always, like, Googling every single thing, what it means that I don't already know and, like, what it means, and even if it's not, like, flagged as, like, too low or too high, but it's really close to one of the, like, borders, I'm like, "What could this possibly be?" If you caught me at on a different day, would it have been too high? Um, and I'm always, like, Googling all of these different things that it could potentially be, which I think also I can go down a rabbit hole sometimes and I need to stop.
Yeah.
But yeah, the internet is so useful in those situations. And I love what you say about bringing a notebook and just writing it down as a type A person. Like that is absolutely what I'll be doing. Yeah.
Yeah, that even goes to, hey, the doctor yesterday said this was the plan. Are we still on track for discharging mom tomorrow? Or has something happened between now and then? And again, it's just keeping track of, because doctors, you may see a different doctor every day,
Hmm.
and they may not always read each other's notes. And so you may get a different plan from one doctor, and it's just good to ask questions. I think they said my mom needed an echocardiogram before she goes home. I don't think that's been done yet. Is that still the plan? And
Hmm.
then you ask why. Why does mom need this echocardiogram? Oh, we're assessing the function of her heart, her ventricle. How capable is it of pumping effectively? That type of thing.
Right. Yeah. And I think this is a good segue kind of into dismissal and neglect that we see sometimes in medicine, especially for women. I know one of the most common things that women are told is that it's anxiety, or it has something to do with their period or hormones or something, even though they know that something's like really not right and they really feel that in their bones. And I know even in our pre-chat, we had some horror stories of women being dismissed. So, from your clinical perspective, why does the system struggle so much to take women's symptoms seriously?
Well, for starters, all the research that was done on cardiac or heart disease used men. And so the classic signs of heart disease or a heart attack in a man is different than what it is in women.
Right.
And so women may not feel crushing chest pain. They may feel nausea. They may feel back pain. So it's not the classic symptoms. But if you know something doesn't feel right, then you have to keep escalating that concern and take it up what I call the chain of command. So if someone's not listening to you, you need to go to another provider. If you're in the hospital, the chain of command is this: the bedside nurse is first who you bring your concerns to. And then if you're not getting resolution or you're getting dismissed, go to the charge nurse. And then there's the house supervisor. And then you could even take it up to the hospital administrator that's on call if it's nights or weekends. And then there's always the chief of medical staff also. So if you feel something's not right, it probably isn't right. And you can't give up and acquiesce and just say, well, he's the doctor, he knows, without taking it further. Um, I do TikTok as well. And I wrote one, and these are all true stories, unfortunately, but a woman came in with symptoms that did not appear as chest or heart problems, and sent her home, and she died of a massive heart attack the day after. So they didn't even do an EKG. So lab work and EKGs, pretty much when a symptom bad enough brings a patient to the ER, should be done. whether we're looking for a lot of diagnostics that can point us in the right direction, or if it's abdominal pain, an ultrasound. I just had a
Mhm.
story the other day about a lady that came in with appendicitis. And again, they blew it off like, oh, maybe it's ovary pain or whatever. And then she came in a couple days later, the appendix had ruptured, which then she ends up staying in the hospital for a couple of weeks because now she's got this massive infection, roving
Uh-huh.
around in her body and trying to kill that infection. So be persistent in your communications and just don't give up.
Mhm. Yeah, definitely. And I would also, I'd love to ask because I always wondered this. I hear so often that there's this like kind of refuse or resistance towards doing testing, either in an emergency situation or even just with like our like regular doctors. A lot of times you really have to push to be like, okay, but I want an ultrasound just in case, or I want you to do an x-ray, or I want blood work or whatever. Is there a reason for that? Why doctors tend to be so resistant towards ordering testing?
I think some of it is they're just trying to clear out the pipeline, so to speak, move you through the system by trying to minimize what you're feeling. Um, that's probably it for the most part because
Okay.
they're so overwhelmed. I mean, nurses are overwhelmed, doctors are overwhelmed. Sometimes insurance won't pay for it, which again, I would prefer to pay out of pocket for something that I think may determine if this is a true emergency or I just need to wait it out because it's not a big deal. And without medical knowledge, it's a little bit hard. But I think, again, if you Google your symptoms or look at your symptoms on AI, again, with a lens of, you know, discernment, which may
Mhm.
be a little bit difficult. But one of the questions I suggest families or patients ask or say to the doctor, could this be worse? If you're telling me it's just gas pains, could it be something worse? Well, yeah, it could be. It could be this or it could be that. Like one of the stories on my TEDx talk about Lewis Blackman, the 15-year-old boy, his abdominal pain, he had chest surgery, and his abdominal pain, they dismissed as gas pains and told him he just needs to get up and walk. Long story short, unfortunately, he died. He had an ulcer that was caused by the pain medication after his chest surgery because it's a NSAID, a non-steroidal anti-inflammatory drug, and then his ulcer ruptured, which he ended up with 3 liters of blood in his abdomen, that caused his death. So we have to look at what else could this be, especially if the symptoms are not improving and we're really concerned. If your mom looks pale, ask about their vital signs. It's easy to Google what is normal blood pressure, what is a normal heart rate, what is a normal respiratory rate, and just ask when they take the vital signs and write it down. And then you have some comparison to trend, because that's the thing with vital signs and sometimes lab work too, is the trends and what direction are they going? More back to normal or we're more concerned?
Okay. Yeah, that's amazing advice. Yeah, look, focusing more on the trends and not just the numbers themselves. And then also that could this be worse? Because I've always wondered really how to ask that question in those situations. Um and not wanting, especially as women, I think we're very socialized to like be small, be quiet, don't make a big deal, don't be dramatic, don't be emotional. No one's going to take you seriously. And you just sit there and you're kind of like, okay, well, I kind of want to ask, like, could this be something more dramatic? Or like, here's what I've Googled and it says that, like, yeah, maybe it's just this, but also maybe it's something cancerous or something that needs to be paid more attention to. But I don't want to sound crazy and I don't want to sound like over dramatic. Um, and so I think that's a really incredible question to keep in our back pockets of could this be worse? Because it's very neutral. It's very straightforward.
Yeah.
And it's easy to remember too. So could this be
Yeah,
worse?
could this be something more serious?
Mhm,
You know?
mhm.
Well, yeah, it could be. The other piece of advice I guess I would love to give your audience, 2 things, is choose a provider that you feel comfortable having a conversation with. and that allows you to ask questions without dismissing you. I mean, I think that is the first place to start, is to get a physician or PA or nurse practitioner to really have a conversation with you and take enough time. But the other thing I would like to say to your audience is make sure you choose, if you have to go to the hospital, I would go on, there's a website called hospitalsafetygrade.org, and you can put in your zip code and you can find the safety rankings of all the hospitals in your area, and they're A through F. I would never, because of the statistics of the harm done at hospitals that are ranked a D or an F, I would never go. I would minimize the C rated hospitals. I would try to find a hospital close enough to you that's an A or a B ranked hospital. Now, on that website, it will give you the ranking, but it'll also give you 32 categories of safety. So, for example, in the surgical category, I think there's 5, 6 different subcategories. How does this hospital rank? And it's easy, red, yellow, or green, just like your gas gauge, right? How does this hospital do with infection rates, whether it's MRSA, C. difficile, et cetera? But that gives you, at least when you go to the hospital. Now, if it's an emergency and your husband's having chest pain, go to I would call an ambulance, of course, but go to the
Right.
closest facilities. But if you have the option to choose a hospital to have your surgery at, make sure you pick a higher rated one. But then also, it gives you, if this hospital doesn't do well with infection rates, the number one thing that healthcare teams or even individuals coming into a patient's room to stop the spread of infection from one patient to another is hand washing.
Mhm.
But you'll see multiple times the healthcare team not wash their hands when they come in the room and touch your mom or your dad or your son or your daughter. Now, some people are a little intimidated to say, "Hey, can you go wash your hands before you touch my mom?" And you may get some pushback from the healthcare team. But when you understand that 1 in 31 patients in the hospital have or get a hospital acquired infection, and some of those can kill, then just keep that in your mind when you need the confidence to speak up and say politely, "Can you please wash your hands?"
Yeah. And uh, there shouldn't be pushback for that even. So I feel like if you do get pushback, it's probably because they're like embarrassed they got caught not following protocol, and that's
Right.
not your problem. So yeah, definitely don't be afraid to ask someone to wash their hands. And that's an incredible resource, that website. And I definitely will link that for everybody in the show notes, so we can always kind of have that in our back pocket, because I didn't know that existed. And that's amazing. And it kind of, I was going to ask you as well, if somebody does have a surgery or a planned hospital stay, what can they do to kind of prepare and minimize their risks? That website's definitely a great resource. Is there anything else you'd add?
I would just say be aware of what's expected, and you can get this information from your doctor, but also look it up. You
Yeah.
know, as you said earlier, we're so blessed to live in the day and age where we've got information at our fingertips. So, what is expected? So, for example, if someone's going in for surgery, one of the top complications is blood clots after surgery that can travel to the lung and actually can kill. That's another one of my TEDx stories. And unfortunately, they're true stories. Everything I write
Mhm.
about in my book and the TEDx talk too. But there are ways to prevent blood clots. So what you could say is, I see that this hospital doesn't have good outcomes for patients that have had surgery with blood clots. What are you going to do, Dr. Jones, to help my mom, not get a blood clot after surgery? And they should easily be able to say, we're going to put on the sequential compression devices on her legs that push the blood flow when she's bedridden back up to the heart. We're going to put her on an anticoagulant, and we're going to get her out of bed walking or sitting on the edge of the bed and flexing her feet as early as possible. Or you could say, this hospital doesn't have a good rating for respiratory problems after surgery. How are we going to address together my dad after surgery so that he doesn't get respiratory distress or a respiratory infection? And then hopefully will tell you, well, we're going to give him this little, it's called an incentive spirometer. And it's a little plastic device where the patient breathes in through this little device to expand their lungs. And they are supposed to do this every hour while they're awake and coughing and deep breathing. And that's going to inflate the little air sacs in the lungs to prevent pneumonia. But I can tell you when I've taken students at clinicals, we'll be taking care of a post-operative patient whose little incentive spirometer is still in the plastic 3 days later. Nobody's ever done it with them. So that is something we can do as family members is say to the nurse, hey, can you show my dad how to use this? And I'll make sure we do it every hour. Those are just again, proactive things that you can do as a family member.
Yeah, that's really important information to know. And I also would love to dedicate just a little section of our conversation today to mothers as well, because I know that they are often labeled as like difficult or overbearing or, you know, being overdramatic. Because obviously it's your kid, and you would rather have some random doctor think that you're crazy and overdramatic than have your kid suffer through a traumatic, potentially fatal event. So, what advice do you have for mothers who are navigating these difficult conversations with providers?
Yeah, I always go back to be present, be polite, but be persistent.
Mhm.
And, unfortunately, Lewis's mother, the 15-year-old boy, was persistent, but she didn't know what she didn't know. She didn't know that she could call the house supervisor. She didn't know she could call the administrator on call. She kept advocating for her son, but it just went nowhere. So I think knowing that you have to be persistent when you know something's wrong, um, gut intuition is real.
Mhm.
And even if there is no hard black and white data to back up what you're feeling, that's okay. You still need to do that because unfortunately, it will happen if you are correct and the team is dismissing you. It will come to fruition. So you just got to keep your eyes on it and then keep looking for the evidence. I mean, you don't want it to be evidence, but you got to keep looking. Like, for example, with Lewis, his heart rate started elevating, which happens when someone's internally bleeding. But
Mhm.
again, it was ignored and his mom didn't know, but his heart rate kept elevating over the hours before he died. And if
Mhm.
someone would have said, "This is not normal, let's look into the cause of this," Lewis would still be alive today.
Mhm. Yeah. Yeah. I love those kind of like the three P's that you said: polite and what was it? Polite,
Present.
persistent,
Uh-huh.
present, persistent. So, and like you were saying with the trends earlier, and heart rate increasing, if somebody had noticed that trend, or if family members were more educated on what these things to look out for. It's a matter of life and death. Like, these aren't over dramatic things. It's the most dramatic thing
Yeah.
in our human experience. It's life and death. And yeah, it's really important to know these things.
I recently created for patients and their families, it's on my website, but it's under the tab Safeguard Health.
Mhm.
And it goes through, I created 6 courses for patients and their families, and I have ebooks on there, like vital signs, post-surgery or planning for surgery. So and they're not really that expensive. There's a lot of resources. You just have to know where to look for them and what to look for and why. But I think that's what I felt like nurses needed their education elevated, so I created all those courses, as you mentioned. And then also patients and families need resources that they can trust. So,
That's amazing. And I definitely will make sure that that's linked for everybody in the show notes as well. So we can all have that. See, I know the websites that we've been talking about, I'm going to have like a note in my phone just to like have them ready to go. So I don't forget them. Cause you never know, like these are the types of things that not everyone plans for necessarily, because they end up being emergency situations or those things where you're like, that's never going to happen to me or my family. And then it does. And you're like, oh, I need to be prepared for this. Yeah.
that's a good point. Most people don't ever think they're going to be on the bad side of healthcare. And those patients and families that I've talked to, they think they're the exception. But when we
Mhm.
look at the data, which is really kind of frightening, and see how many patients are impacted by medical mistakes, I think it's I hate to say this, but it's not a matter of if, but probably when. If we're talking 1 in 10 patients suffer some kind of harm in the hospital, that means it very well could be our family member. And so I think just knowing about this and then getting informed bit by bit so that you are prepared. We're all going to be or have a family member that's a patient someday.
Yeah.
You know, I mean, that's just how our healthcare system is and the health of our country, right?
Yeah.
We're not very healthy.
No, definitely not. Definitely not. Yeah, that's so important, and, um, yeah, like you said, just this preparation, like, it can feel scary learning these things and learning that, like, these aren't actually the exceptions, they're way more common than you think. That is terrifying for sure, but knowledge is empowerment, and instead of letting it drown us in this fear, it's like, "Okay, well, let's be proactive about this situation," because using all of your advice that we've been talking about today and enacting all these things during a hospital stay, you are taking that 1 in 10 number and making sure that, or doing everything you can to make sure that you're not the one. And the more people doing that, the less holes there would be in the system overall. I'd love to add, we are coming up on the end here, but I have a few more questions for you. In kind of an ideal world, I guess, from the clinical systems perspective, what is the first thing that you would change to reduce or eradicate patient harm?
That's a great question. So, the Joint Commission, which does hospital accreditations for most hospitals in the US that get, well, all hospitals that get reimbursements from Medicare, Medicaid, which all of them do,
Mhm.
told us and has for several years that communication breakdown is responsible for 70% of harm events to patients. So that communication breakdown could be between a doctor and nurse, could be the radiology department and the nurse. It could be, I'm going to include patients' family members in there too, because if we don't speak up and say, hey, my mom isn't acting like herself, and the healthcare team assumes that's just her normal, that's also a breakdown. So I think communication, if we could improve communication, meaning patients and families feel confident to speak up, even if they don't know what's going on, but they know something's not quite right or feel like it's not quite right. And on the other end of that, the healthcare team listens. The healthcare team takes you seriously and say, oh, well, let me check into that. Let's do some further assessments. I'll keep a real close eye on your mom. I'll come back in the room in 15 minutes and let's see how her heart rate or her breathing or whatever the issue is doing. I think we need that back and forth. The healthcare team needs our help, the patients
Mhm.
and families' help. And I think, having that open communication and getting rid of medical gaslighting or dismissal is so important.
Mhm. Absolutely. And that it makes sense that communication would be that number one thing because just most people I think have been in a hospital at some point in their life and or at least we've seen it on TV. There's plenty of hospital dramas. It's crazy. Like it's there's so much going on. And there's just so many different things and taking that active role as a patient like you've been saying is just probably one of the most powerful things we could do in that situation because yeah, the doctors and the nurses, they did go through a crazy amount of education and training. They know, like, they know all the technical stuff, but by you asking questions, you can still raise flags because they're human too. They're
Right.
human and they're dealing with God knows how many patients in God knows how many different situations, different medications, all of these things. And yeah, anything that you can do to be an active member or an active player in a family member's care or your own care is gonna make a world of difference.
Yeah, for
Yeah.
sure.
Yeah,
Mhm.
that's an amazing, amazing message. This has been such a great conversation. I know that everyone, is going to get so much out of this. I do have one last question that I like to ask all of my guests, at the end of our interviews. So if you could rewrite the health class curriculum that every woman deserves, what would your first lesson be? So, yeah.
Yeah, I think that as we mentioned earlier, women have been minimized for so long that our voices have not been heard. that we are dismissed much more often than men. And I think even just number one, having studies that pertain to just women, like endometriosis. Both of my daughters have endometriosis and they've gone through pretty much hell for,
Me too.
years. Oh,
Yeah. It's
about
awful.
yeah, and I think recognizing that we're not men and we've got our own unique our hormones are different, which impacts everything in our body.
Mhm.
So I think we need to address the differences in health class education for nurses, for doctors. Um, but I think also the biggest piece of what I want the message to be today is we need the heart back in healthcare because every patient is someone's mother, father, brother, sister. And I think we get in such a hurry about doing the tasks and getting through what we need to do that we don't realize or we don't stop to slow down enough to recognize that person in the bed is a
Yeah.
human being, and
Mhm.
it's not deliberate. It's
Right.
just the rat race and the hamster wheel we get stuck on.
Yeah. And the numbers of it all too, like there's so many numbers when you're dealing with patients and stuff. And I think that also just from a very personal perspective, when I'm weighing myself over counting like those unhealthy kind of, disordered eating habits that I used to struggle with, you become a number. And I can imagine in healthcare with all of the vital signs and all of that, all the numbers kind of puts this gap between human and just the rat race, like you're saying. Yeah.
Yeah, and I think even the diagnosis,
Mm,
is
mhm,
another one of those traps that we can fall into, and they call that cognitive bias.
yeah,
So that really does impact the care, especially around women.
yeah, absolutely. And like you said, with knowing your daughters have endometriosis, I'm sure there's a crazy amount of advocacy that had to go into even to getting those diagnoses. I know mine took 12 years, but um, it, that in itself is an incredibly misunderstood disease, both
Yeah.
in and out of doctors' offices. And so that cognitive bias, like you were saying, really applies a lot to diseases that are affecting primarily women because they're just so misunderstood and there's so much bias around them already. So,
Yeah.
yeah, yeah.
It's a battle.
It is for sure. But this has been, I mean, this is going to help so many people. I know my listeners are really going to enjoy this. And I know that I do have a lot of people over here from TikTok now, especially from that series. And I think that the timing worked out so well with this. I couldn't have planned it better. Because I already have, clips in my head that I'm going to put on TikTok in relation to those videos from this conversation because there's so much amazing information in here.
Yeah. When I started my TikTok about a year and a half ago, that was my intention, is just
Mhm.
to share as much information. And a lot of it is here's $1 million lawsuit that happened,
Mhm.
and here's what you should learn from this as a family member. If
Mhm.
your dad falls and hits his head and he's on a blood thinner medication for his heart, you automatically need to suspect that he's going to have a head bleed.
Mhm.
And if we go down that route, then when you take your dad to the ER because now he's had mental status changes, at least then you've got as you said earlier, being informed, you've got a little bit of knowledge to say, hey, we need to check this out. My dad needs a CAT scan.
Mhm. Yeah.
And so I think it's about education, empowerment. Um, and I know you're on that journey to help, and so am I. And I think, the more people that can just stop and pause and go, oh, I hadn't thought about that, then we've
Mhm.
done our job, right?
Yes. Yeah, absolutely. 'Cause I mean, and you've already done that for me today. There's quite a few things where I was like, "Oh, I didn't think about that." And especially, I'm sorry, mom, if you're listening. I'm 26. My parents are getting older, and
Yeah.
I feel like it's inevitable at some point that some event happens. So yeah, this makes me feel
Yeah.
safer for sure, and I'm sure a lot of my listeners feel the same. So thank you so much, Dr. Julie. This was incredible.
You're welcome.
Thanks. And make sure you guys check out the show notes for everywhere you can find Dr. Julie. I'll tag your TikTok and everything as well as the websites and things that we have talked about. And you guys can also find all of my information in the show notes as well. Thank you so much for listening and class dismissed.